Talk and thank you, ma'am, for joining us for the evening session, taking your evening time. So, let me give a short introduction to adaptive health by the time let others join us. So, it is said that it takes a village to nurture a child. So, for a special child, it will take more. With right kind of support and guidance, we can nurture the child in a better way. Dazzle Health is a digital platform that provides support and guidance for families of children with special needs. We provide assessments, therapies, and a whole range of services through our marketplace. We help you to track your child's milestones and answer queries on daily basis through WhatsApp. We also conduct various training sessions to enable you to nurture your child. If you would like to know more about us, you can just visit our website www.dafterhealth.com, and you can follow us on our Instagram and Facebook pages to get on our regular updates on our program. Then, today, I welcome you, ma'am. We have Dr. Riddhi Taneja for today's talk. So I'm really grateful to have you for today's session, ma'am. And let me give a short introduction about Riddhi Taneja, ma'am. She's a dentist and a cosmetic surgeon. She's done a post-graduation from University in New Zealand, and she has worked with special needs children in New Zealand. And she has done a lot of international speaks during COVID era. So now, ma'am, I hand over the session to you. You can. You want us to share the slide, no, ma'am?
Yeah, you're correct. Thanks, Tinu, for the wonderful introduction. Good evening, everyone. Am I audible?
Yeah, ma'am, you're audible. Amal sir, can you just share the PPT?
Yeah, I'll do that. Just give me a second.
Good evening, everyone. First of all, I would like to thank Tinu and Defident team for this wonderful webinar. Let me give a little bit brief of myself. Dr. Riddhi Taneja Chaudhary. I'm a general dentist plus cosmetic surgeon. I'm also a social speaker on health-related issues. I have completed my post-graduation from University of Auckland, New Zealand. I've worked with the special children in New Zealand. Along with that, I'm also into aesthetics, which includes Botox, fillers, thread lips, chemical peels, and PRP. And today I'm going to exchange my views on dental awareness among special children. Please slide. Yeah. So first of all, I'm going to discuss about what is special children. Children with the special healthcare needs are considered by the American Academy of Pediatric Dentistry as those who have any physical, developmental, mental, sensory, behavioral, cognitive, or emotional impairment or limiting condition that requires medical management, healthcare intervention, and or use of special services or programs. The estimated prevalence of children with special healthcare needs ranges from 13 to 18% of the population under 18 years of age in developed countries. In the US, it's 13% of children in adolescents age 17 and younger and have a special need for healthcare. In the last decade, several strategies to decrease the risk of caries have been implemented with preventive success. However, children with special healthcare needs still show limitations in maintaining a good oral health. Early childhood caries being highly prevalent. Furthermore, special diets, medications, and oral motor habits like atypical swallowing, lip sucking, tongue interposition can favor the development of dental complications in the children with special healthcare needs. There are various methods for the evaluation of caries risk among the group of patients. For example, there are caries risk assessment tools provided by the AAPD and American Dental Association, and other protocols such as the case management by risk assessment. Next slide, please. Universally, it is noticed that the moderate or severe gingivitis has been increased with the age and degree of mental retardation. Local factors such as the tooth morphology, malocclusion, macroglossia, bruxism, and lack of normal masticatory function have been suggested as contributing factors for dental diseases. Please mute yourself. Thank you. Yeah. Children with limitations in adaptive functioning have sub-average abilities to perform self-care activities. Brushing of teeth at least twice daily is recommended for children. However, toothbrushing is a challenging task for children with special healthcare needs. This is already known to everyone, but how to deal with this situation? Okay. So how are we gonna do it? Like oral hygiene maintenance is a challenging task. Everybody knows for the special health care children, as those children are likely to have abnormal tension of facial muscles, poor control of lips or tongue, insufficient gross motor capacity, and sub-average cognitive abilities to understand the importance of oral hygiene maintenance. Adaptive behaviors include conceptual, social, and practical skills that are learned and performed by people in their everyday lives, which encompass a range of behaviors that are essential for everyone functioning, including daily skills, social competence, functional communication, leadership, and adaptability. Limitations in adapting functioning were common among children with special healthcare needs. Due to lower acquisition of adaptive skills, children with special healthcare needs usually rely on family members or caregivers to accommodate their daily living activities, such as brushing teeth, changing bandages, or administering medications. For children who have severe functional limitations, parents are likely to bear a greater caregiver burden. The long-term burden can disrupt parents' professional, household, and social roles, resulting in a poor quality of life. Tooth decay and periodontal diseases are reported to be the most prevalent dental diseases of mankind. Both of them can be initiated or deteriorated by the accumulation of dental plaque. Therefore, plaque control plays a critical role in oral health promotion. Among the existing strategies, brushing of teeth at least twice daily is a low cost and widely recommended strategy for plaque control. If a child showed no compliant behaviors, then try to put their hand under water. Can you please go for the next slide? The next slide.
Should I go one more?
Yeah, sure.
Are we on the right slide now?
Yeah, correct. Yeah. Now, if a patient is or if you can say, if a child shows no non-compliant behaviors, then try to put their hand under water, which will help children to enjoy as a water activity game and demonstrate the brushing technique along with them. If patient is non-compliant in all cases, then at least clean it with some cotton swab, gauge piece, dental floss, or rinse their mouth. Children establish the toothbrushing habit before the age of 12 months. Children should dispense. Okay, I'm gonna demonstrate like how to do the brushing techniques in the children. Just give me a moment. Let me bring the operator so that I can demonstrate that.
இது
Hello. Yeah. Yeah. Suppose this is the teeth. Are you able to see me?
Yes, ma'am.
Yes,
Yeah.
ma'am. Yes, ma'am.
So for the children brush, we have to take a pea-sized paste, a little bit like a pea-shaped size. So what we have to do, we have to go into the rotation movements like this. Then for the upper teeth, what we have to do, we have to do it in the downward direction. We don't have to like rub it, because what we're gonna do is we're gonna chip off the enamel. Whereas if we're going in like from palatal side, what we have to do is for the upper teeth, we have to do the full stop like this, outwards direction. Okay, and whereas in the lower teeth, same the rotational movements. Over here, we're gonna go upwards like this. And lingual side, again, we have to give the full stop. We don't have to give the push stop. Can you see it? Like this. So this is the brushing technique. In children, we can follow it. And we all, if there is no like manual brushing is not helpful, then we can go for the electric brushes. So yeah. So, I think parents play a major role in the child's brushing technique. So parents should spend time and efforts in cultivating appropriate oral hygiene practices for children with special healthcare needs. Children's gender, age, socioeconomic status always plays a role in maintaining the oral care. Studies have been shown that after adjusting the socioeconomic status, and when child comes to a certain age, children with high levels of adaptive skills were able to practice more toothbrushing steps than those children who had low adaptive skills. Children who had initiated the toothbrushing habit before age one could practice more toothbrushing steps than those children who established toothbrushing habit after age 1. Considering the benefits of early initiation of toothbrushing habit, children with special healthcare needs are encouraged to establish regular toothbrushing habit in their early childhood. However, younger children usually try to hide themselves from toothbrushing. Non-compliant behaviors includes gagging, crying, running away, refusing to open the mouth, biting the toothbrushes, or not to able to keep. We can frequently observe these things. Children with special healthcare need parental assistance to maintain good oral hygiene status going to be required. However, children's resistant behavior can make parental assistance extremely difficult to be implemented. Therefore, toothbrushing training should be provided to young children with special healthcare needs. The early childhood training programs can help those children to improve their toothbrushing performance and reduce their parents' and caregivers' burdens. Toothbrushing training programs should be catered among preschool children with special healthcare needs. Those training programs may prevent plaque-induced dental diseases among the children with the special healthcare. Meanwhile, children's self-care ability can be improved by early intervention and the caregiver burden can be reduced. So we're going to discuss how establishing regular toothbrushing habits at an earlier age might contribute to better toothbrushing performance among children. Early toothbrushing techniques should be recommended to safeguard the oral health status of young children with special healthcare needs. Establishing good hygiene habits are valuable for present and future oral health. Below 6 years, toothbrushing should be performed by parents, as increasing dexterity and cognition may permit supervised brushing until the child is capable of independent brushing. So now comes to the prenatal oral health counseling. The purpose of prenatal oral health counseling is to educate the parent about dental development of child, dental diseases, and its prevention. And then there is also one treatment, that is topical fluoride application. The recommendation for professionally applied topical fluoride in medium caries risk patient is applied, where varnish is applied every 6 months to avoid futuristic delayed caries treatment, as this application going to reduce the caries. We can also apply in the pets and fisher, and the fluoride safe dose is 8 to 16 milligram right per body weight. So can you please the next slide? Switch to this next slide. Yeah. So yeah, children with autism spectrum disorder and intellectual disabilities are more vulnerable to experiencing anxiety disorders. Parental involvement in intervention is crucial for successful management of the interventions in the population of people with ASDs. Parents are considered as a main source of support for their children throughout the child's lifetime. The majority of caregivers can give better care to their children than anyone else. Parents usually spend more time with their children in different and more diverse situations. A number of factors contribute to this. The majority of caregivers can give better care to their children than anyone else. Parents usually spend more time with the children in different and more diverse situations. Teachers also have a crucial role, not only in early recognition and evaluation of any behavioral problems in children with ASD, but also in the management of these behavior and monitoring the progress of such child. Literature regarding teacher involvement in intervention often has positive outcomes for individuals with disabilities. Hence, it is important to involve teachers in meaningful ways in research-based intervention. The comorbidity of ESD and intellectual disabilities make these children and young people more susceptible to anxiety. Individuals with mild to moderate ASD and ID have higher abilities and proportionally more disabled by their autistic features, and they are therefore more likely to develop mental health problems. They are more vulnerable to experience anxiety as a result of the interplay between ASD and ID and other factors, for example, lack of social and cognitive resources and poor coping skills. Research has also indicated that emotional and behavioral difficulties can have important effects on family well-being. And anxiety causes family dysfunction or parental stress. Even I can give you an example. When I was in New Zealand, I have seen that most of the ladies were single mothers who were raising their kids. When I asked them about it, then their reply was because the male was not able to cope up with the circumstances, so they have to split. Even the studies have shown domestic violence, kids raising in broken marriages have compromised cognitive skill. So what's the solution? So there is the semi-structured interview to be conducted in order to explore the interventions, processes, and procedures used by parents and teachers in anxiety management of children and young people with ASD and intellectual disabilities. There is a process called Delphi. Thanks. The Delphi process is used to discuss the strategies revealed by parents and teachers with an expert panel of health professionals. The aim of the Delphi process is to develop consensus about this appropriate and effective anxiety management strategies for children and young people with ASD and ID. The expert panel of health professionals is selected for the Delphi process. The panel consisted of 5 professionals, a child and adolescent psychiatrist, a clinical psychologist, educational psychologist, a social worker, and a community nurse. Recent study of parental program is done in England, where parents were invited to participate in the second phase. Parents were recruited through the advertisements, newsletters of the autism support groups at West Yorkshire and northeast of England, and through special education schools. Participants were mothers aged between 25 and 49 years who were parents of 7 children, that is 6 boys and 1 girl, aged 5 to 14 years, with a mean age of like 9.04 years, with a diagnosis of autism. The inclusion criteria for those children were mild to moderate intellectual disabilities, living at home with their parents and not in any other treatment or appropriate intervention for anxiety or any other medication for the term of intervention as identified by parents. Glasgow Anxiety Scale for children with intellectual disabilities was used to assess anxiety before and after implementing the program. The Glasgow scale covers 3 domains. One is the worries, the second is the specific fears, and the third one is the physiological symptoms. It consists of 27 items. Focus group was conducted with the parent participation who had implemented the Child Calm program to identify its usefulness and impact. Then in that program, parents were followed up every fortnightly by telephone. They informed the researchers of their progress made in supporting their child in managing their anxiety. At the end of this implementation period of 3 months, parents completed the scale about their child and an evaluation form about the program along with the monitoring diary for the full term of the intervention. In addition, focus group was organized for the parent participate. Now come to the management strategies used by teachers and parents. What are they? So they are the talking or explaining, distraction, visual schedule reassurance, physical activities, relaxation techniques, quiet time, cuddling, having little fun, grading the anxiety, remove physically from the situation, and rewarding. So the final findings suggest an improvement in parenting skills of managing anxiety in everyday situation following the completion of Child Calm program. Positive effects of Child Calm program interventions have been reported by parent participation, including improving parenting practices, increasing positive interaction with children, structuring the family life, establishing strategies for everyday situation, a home routine that contributed in overcoming some of the obstacles that the family faced. In addition, the Child Calm program contributed to the development of self-management, self-regulation skills. Parents described that any change in their child's behavior was attributed to participation in the program. It is important to indicate that the strategy implementation is influenced by choice and individual limitation and differences. While some children enjoy listening to music as a relaxation technique, other children prefer physical exercise. Then the primary outcome of the evaluating the Child Calm program indicated a decrease in the anxiety level of children or young people. The secondary outcome indicates that the CCP was helpful for parents in enhancing their skills to manage anxiety for their son or daughter. There has been a tendency with the research community to view caring in pathological terms. Child Calm program has enabled parents to improve their confidence and to have a better knowledge of recognizing and managing anxiety. Providing parents with the most appropriate program and useful strategies to help their children cope up better with anxiety can increase the child's competency in coping with the anxiety, as well as improving their confidence and the ability to manage the anxiety of their son or daughter. There is a wealth of literature about family intervention and early intervention program for autistic spectrum disorder in children, such as the Sunrise program and applied behavior analysis These programs encourage many positive improvements for families, such as enhancing parents' confidence, relieving parental stress, cost effectiveness, enhancing the capacity of the family, and increasing quality of life. There is evidence concerning the efficacy of some of these management strategies for a range of mental health needs, including anxiety for young people with autism spectrum disorder, such as the cognitive behavioral therapy. It is important to highlight that the combination of different approaches in this study was similar to the CBT program, which is applied in previous research concerning anxiety in children with Asperger's syndrome and ASD. Behavioral approaches may, in fact, be the prominent approach for the intervention in children with intellectual disabilities and autism spectrum disorder. The findings support this possibility that is more than cognitive and emotional strategies, behavioral strategies is identified by the parents as the most effective strategy to manage Priya and Raghavan's 9 children's anxiety. The results also concur with the Stepping Stone Triple P Standard program, which has demonstrated its efficiency as a useful intervention for parents of children with developmental disabilities. The Triple P Standard program involved teaching parents 25 strategies to facilitate children's behavior. For example, talking, quiet time, discussion, distraction, and engaging activities. Moreover, intervention studies indicate that relaxation strategies appear to be effective in reducing anxiety. Physical activities have been used for different disorders. Visual scheduling is a family treatment strategy used by parents of children with ASD. The anxiety thermometer has been suggested to be used by parents in managing anxiety in young people with ASD and typically developing children. Existing evidence of the intervention studies demonstrated the potential feasibility of CBT in reducing anxiety among these people with intellectual disabilities and autism spectrum disorder. Then the CCP supports parents to manage their child's anxiety, thus enhancing the family protective factor and reducing associated with severe emotional difficulties in children and with ASD and ID. It also helps to develop parental capacity and their expertise in planning and delivering interventions and evaluating its application and impact. The parental program can also help reduce the distressing emotional reactions of parents, including depression, anger, anxiety, high levels of stress, especially within the parenting role. Providing parents with a practical and appropriate program of strategies helps them to strengthen the family capacity to meet the needs of the child. In our study, where the parents reported that proactive strategies prove very useful in managing children's anxiety in day-to-day life. Children Calm program is to be considered as a parental intervention in everyday life of the children with intellectual disabilities and autism spectrum disorder, as it equips parents and children with strategies they can use it in everyday life. The advantage of being in a familiar environment and the flexibility to apply the strategies in a family context would be helpful for the children with ASD. Findings suggest that the Child Calm program encourages parents to interact with the children and to implement intervention. This has the added benefit of developing parental expertise in the delivery of anxiety interventions and may help to reduce the high workload of child and adolescent mental health services. So, can you please play the video, the one which I've sent to Tinu? Is
Sure,
the
yeah.
mic? Hello.
I'll do that. I'll do it.
Yeah. I'm still, yeah. Can you please play the video that's gonna show that how to calm the children? Yes. Calming strategies for autism. Yeah, exactly. With the volume, please. I got the question.
Is the audio okay? Are you
Yes,
able to
yes.
hear the sound?
Yeah, we can hear. We can hear.
Want to change? You want our boots off in here?
It's fine. You can have them on.
Go ahead, honey. It's okay. I'll be right there, okay? Thanks for that nice waves. Be right there.
Now I'm gonna take some of the questions. Hang on.
Ma'am,
Yeah. Yeah.
yeah, ma'am. I'll tell you the questions. You can answer it, ma'am. I'll read out the questions.
Yeah. Yeah. I have the questions with me.
Is root canal necessary if most of the teeth looked damaged? That's the first question. So, ma'am, can you just
Yeah.
answer?
First question. Seeing the special children, we have to plan a little bit differently. If you have attended my last session, in that also I mentioned that never treat special child in your first visit. The treatment should be underwent in one setting because you never know whether the child is compliant or not. I share you with my experience. Like I was working with the oral surgeon. We both were like doing the treatment under GA. So we plan, like before the treatment, we plan that we're going to do the one sitting, single sitting hour sitting. But the tooth was grossly curious during the treatment. It was breaking up. So I had to decide on the table for its extraction because I had no alternative because you cannot go for general anesthesia on a regular basis. Why do I give stress more on early intervention? Because the longer we wait, the longer would be the duration of the treatment and costly would be the treatment. So I advise each and every parents or guardians to go for routine dental checkups. And along with that, yeah, what's the question?
So, next is how prevalent are root canal treatment in autistic children, and should we
sedate them to get an
should we
X-ray of
sedate
teeth?
them and
Yeah.
get an
See
X-ray?
yeah, go ahead. See, the literature reports that autistic children with primary or mixed dentition can present higher quantities of dental caries and gingivitis, while children with permanent dentition had significantly more gingivitis and malocclusion when compared to other oral disorders. In my opinion, since the increasing occurrence of the autistic disorder, it is very important for the clinicians to know how to manage these dental injuries. In patients in developmental age, ensuring an adequate and minimally invasive management using a prompt approach when possible. For getting the X-ray, we can choose laughing gas, sedation system, body wraps, and mouth probes, lighting, radiographic exposure, and imaging system. Dental isolation devices and other tools, we can use it. Commercially available tools will allow you to gently mobilize and sedate these patients and to perform an oral examination and obtain a radiograph and treat them in your office. The clinician's attitude without the right personnel, any tool loses its effectiveness. I also have had more success with the benzodiazepine sedatives, which include either liquid or pill diazepam, triazolam, and lorazepam. We also occasionally use other sedatives, narcotics. We use such chemical restraints across all ages and weight ranges with special attention to the lowest effective doses and maximum recommended doses is listed in the physician descriptions. And patients are also asked to come to the office on a 6-hour empty stomach in order to prevent aspiration during the visit. And we also ask caregivers to give patients any oral sedatives 30 minutes before the scheduled appointment times, and nothing they can have by, like through a mouth. And I think that's it.
Okay, ma'am. Thank you. And next is like how to
one more thing I want to add to that previous question is that we can even use the nitrous oxide or laughing gas can be considered the like safest sedative available with no contradiction as long as an adequate percentage of oxygen is administered.
Okay, thank you, ma'am. Now, next question is how to address teeth issues with children with special needs. So, any tips for parents? They ask for some tips.
See, they often fail to define dental problems. Okay, and a family-centered approach can be useful to improve and intercept these disorders. So, first one is that they're not gonna have anything like they're gonna point up their finger to the nearby or the affected. So I think this one is the major, if I can say. Or you can, yeah. One more thing is that always go for the like 3 months, after 3 months, try to visit your nearby dentist or any old therapist or any hygienist so that you come to know.
Now, next set of questions is regarding brushing. So, how do you handle sensory issues in the child while brushing?
I said, just a second. Yeah, as I have discussed in this session, that non-compliant behaviors, gagging, crying, running away, refusing to open the mouth, biting the toothbrushes, are not able to keep, we can frequently observe in these patients. Therefore, toothbrushing training should be provided to young children with special healthcare needs. The early childhood training program can help those children to improve their toothbrushing performances and reduce their parents' caregivers' burdens. The early you start, the early child going to adapt those skills.
Okay, next, thank you, ma'am. And next is the child doesn't independently brush and doesn't know not in a proper way. So, how can we improve that?
Yeah, there is a electronic brushes. Hang on, pasting the link also. Just I'm pasting. Just give me a second. So these are the electronic brushes you can use, or you can get it like nearby any pharmacy stores.
Next set of questions is regarding how to stop mouthing, and he keeps everything in his mouth. So, ma'am, your opinion?
See, yeah, for this, we can also, this procedure we can also do in the thumb sucking patients. What we do is like there's an anti-thumb sucking appliance which can be used. For that, you have to consult your nearby dentist. If it is not improved by following mentioned strategies, then discussed in this session. We go for the anti-thumb sucking appliance.
Okay.
Or
So,
the strategy that I have mentioned, you can follow that.
next is also related to this oral sensory issues, like how to reduce oral sensory issues like mouthing and biting. So, I think
Yeah, again,
I
I've said
almost
that,
answered.
yeah, the same answer.
So, I'll just go to next one. The child eats toothpaste without brushing. So, how to go about it?
See, for that, you have to attend the brushing, like toothbrushing technique programs. Because I remember, like when I was working with the special child, so I had the two clients. One was the female, and like one was the girl, and the other one was the boy. So the boy was non-compliant, okay, and whereas the girl, I just demonstrated her like how to do it. I taught like her mother, and in the second visit what she did was like she just uh, like take the brush from my took my the brush from my hand, and she said, I'm like, as she was non-verbal, but she was like, I'm gonna do it. So while in the boy, I taught him like more than 1 week. Is it various toothbrushing technique programs that the parents can go for it.
Next is like sensitivity in upper teeth.
Okay. See, first for that, we have to go for the radiograph, that is the IOP. If it is not possible, then I would suggest to go for the Sensodyne KF. But for that, you just have to apply it for 15 days. What you're gonna do again, the pea-sized shape, take the toothpaste and then apply to the affected area, like on the specific tooth, wait for like 5 seconds, and then brush it up. But remember this, you have to just do it for the 15 days. Okay. not more than that.
Yeah.
Because
And
the reason is that there is a less fluoride in that. So,
okay.
and yeah, and for the tooth, for the like to prevent from the caries, we need the fluoride in the toothpaste.
So how to deal with the gap in between the teeth? So any suggestions on that?
Before that, we have to know the child's age, like because there is a private spacing is common in children, like to give space to their successes. If it's in teenage, then all permanent dentition is erupted. Then we can think of veneers or luminous placement to treat the diastema. Otherwise, the spacing is normal in the children to the certain age.
In the chat box,
Yeah.
Gauzia ma'am has put a question.
Okay,
Determined program by dentist for children visiting dental office. Can you just kindly elaborate on that?
Yeah. Sorry, come again, Tina.
Determined program by dentist for children visiting dental operatory.
Yeah, and that what we do, we're gonna teach them the repetitive skills. I have mentioned that this help the children with the ability to learn the cooperation skills necessary to receive treatments. We're gonna repeat it once again. That's why I think many of must be aware of my last session in which I mentioned that never treat on your first visit. Always treat it like first visit has to be like how to counsel it, how to get to know about the child behaviors, and you have to demonstrate it. You have to demonstrate it, like what are the treatments you're gonna perform. So it's like a repetitive repetition of the treatment that what you have gonna do it on the child.
Okay, I think that question has been answered to those. Then next is from okay, this is your answer.
Yeah, my daughter is under Caesar treatment of totally 7.5 level per day. In specific care, I need to take care with respect to dental care. Who have asked this question? Padma, right?
Yeah.
First tell me, like, is your child is compliant? Like, does he or she listens to you?
Patna ma'am, if you're there on call, you can just unmute and talk.
So
Yes,
the
ma'am.
condition of her oral health care or oral care.
Yeah, she will follow the instructions, anything that we try to tell her. And it's been almost 6 years that she's been on seizure treatment. So
Yeah,
it's,
I can tell you that the main disadvantage of the anti-epileptic drug is that the gingival enlargement. Okay, so for that you have to underwent oral prophylaxis, like
okay.
scaling. So what you can visit nearby, any dentist, so that they can perform the oral prophylaxis treatment on your child.
Okay.
And along with that, they also give the 0.2% fluorhexidine mouthwash, but you have to do is like 1:1, you have to do it.
Okay.
So you can also do that one.
And I can see the gap between the two.
Yeah.
So
Can you tell me the age of it? I have already answered
he
it.
will be completed 10 years by November.
Yeah, these are the like primate spaces. These spaces are known as the primate spaces.
Okay.
Which you can see in every child. Basically, these spaces are like give the space to the successor, that the permanent dentition has to come.
Okay. Okay.
Or the second option is that you can also go for the like OPG or the IOPA, so that we can see that is there any impacted teeth or anything is there in the cavity.
Okay. Sure. And one more issue I face is from her very younger age, she doesn't chew properly, and
She
she
doesn't
used
want.
to chew only in the one side.
Okay.
And when she's trying to swallow, either she will use water to swallow, put something, and she doesn't chew properly and tries to use drink water to swallow the food stuff.
See, for that you have to demonstrate her. Like
Okay.
little bit often you have to do it.
Okay.
Or you like show her some videos. If you
And
can,
one thing which I may notice is that the chewing is not same process for all. For the
yeah.
specific ones she chews, for those that she has not affinity towards, the chewing is less. That's what I've noticed.
See it to like use some patience and sit with her, like
Okay.
try to
Okay. Yeah.
demonstrate her. That is the only solution I can give that.
Anything to make any technique that, or a simple technique which can make her to use chew both the sides. Anything?
See, demonstrate her.
Okay.
That's
Yeah.
what I said. Because they're gonna see it visually and they're gonna adapt it.
Sure. And thank you.
Yeah, like,
So we have a few more minutes. If anybody wants on the call wants to ask question to ma'am, you can go ahead, unmute yourself and ask.
Sorry, I had put another question. Any music that to enhance the concentration for ADHD children, attention for ADHD children? Anything specific?
any soothing music. You're gonna get plenty of it on
Okay.
YouTube. Yeah, any soothing. Like you have to experiment it, try to switch it up and see the reaction of the child on which music is showing better skills. So there's not a particular music, just the soothing music.
Okay. Yeah. Thank you.
Patience.
And anybody else you want to go ask ma'am anything?
So I think it was a lovely session. Thank you.
Thank you, ma'am, for taking your evening. Since we don't have much questions from anybody, so we'll end the session. Thank you, ma'am, for taking up your time on an evening and spending so much time with us. Thank you so much.
Thank you,
For
Bill team.
and I
Bye-bye.
think,
Yeah. Bye.
yeah, I think this was a learning for the parents also. So they had a lot of learning from you. So thank you, ma'am. Thank you so
Yeah,
much. And thank
if for parents also, you can like contact me anytime. I'm there to help. Like it's my privilege. I can help anything, you guys. So you can contact me. Yeah. So through her, I'm able to answer all questions. Thank you very much. See ya. Bye.
and thank you, participants, for taking your time on a Saturday evening and joining us for the call. And see you for our next sessions. Thank you.